Assalamualaikum and good day. So we will continue next subtopic in schizophrenia, which is anomalies in schizophrenia. So what is anomalies? It is defined as peculiarity, oddity, and abnormality. Okay, so it's important for us to identify anomalies because research show that the developmental of schizophrenia is also associated with behavioral, physical, and brain anomalies. And interestingly, some of these anomalies are present even before the onset of symptom of schizophrenia or is present in unaffected family members. Okay, which all of these evidence support the biological and genetic basis of this disorder. Okay, so in next slide I will explain uh, the research evidence based on these three types of anomalies. The first anomalies is behavioral anomalies. Both behavioral and anatomical evidence indicates that abnormal development is associated with schizophrenia. Based on few behavioral evidence that obtained from research on home movies among families with a child who was later diagnosed with schizophrenia, suggests that in comparison with the unaffected sibling, children who later diagnosed with schizophrenia display more negative effect in their facial expression and were more likely to show abnormal movement. Okay, in a similar study also suggests that child who later developed schizophrenia display less sociability, and among the boys, they somehow display deficit in the psychomotor functioning. Okay, so from this study, from the results, are suggesting that even though positive or negative symptom of schizophrenia not clearly seen in childhood, however, the early brain development of the children who later develop schizophrenia is already altered during the early years of childhood. Next, physical anomalies. Physical anomalies basically based on the minor physical anomalies that have been shown to be associated with the incident of schizophrenia. Okay, so study also suggests that people who have relatives with schizophrenia and also have abnormal physical anomalies likely to develop 30.8% of schizophrenia as compared to those having only a relative with schizophrenia. Okay, so meaning that if you have schizophrenia at the same time you have the abnormal physical anomalies, so it's like 30% of you might develop schizophrenia. Okay, so most of the physical anomalies is related with the craniofacial changes of the head, eyes, ears, and mouth. And anomalies in these physical features may be closely related to underlying brain development and may arise from common developmental processes. The third anomalies, okay, so here actually the location of minor physical anomalies and description according to each location. The third anomalies is brain anomalies. Okay, so many studies have found evidence of loss of brain tissue in CT and MRI scans of people with schizophrenia. One of the earliest study, okay, as you can see in the illustration, okay, in the graph illustration, actually the study compare the CT scan of 80 people with chronic schizophrenia, okay, and 66 control of the same mean age 20 years old without schizophrenia. Okay, in the study the researcher measured the area of lateral ventricles in the brain in the scan that cut through at the largest extent. Okay, so the researcher expressed that this area relative to the area of brain tissue in the same scan, and from the finding suggests that the relative ventricle size of the schizophrenia group was more twice than agreed of the control group. Okay, so thus this can provide evidence that schizophrenia is associated with brain abnormalities. In fact, in other different studies suggest that although everyone, even normal healthy people, also lose some cerebral gray, okay, in gray matter in the frontal and temporal cortex, okay, that the rate of tissue loss is greater in patients. Yeah, okay, as you can see, uh, another research show that a comparison between patients with schizophrenia and healthy volunteers, so it's higher as compared to the healthy volunteers. In another study, okay, on the monozygotic twins with which discordant for the schizophrenia, that is one twin develops schizophrenia and the other does not. Okay, from this study obtained evidence that the difference in the structure of the brain actually the main cause of this discordance. Okay, so from a study it actually suggests monozygotic twins who were discordant for schizophrenia. Okay, and in almost every case, the twin with schizophrenia had larger lateral and third ventricles, and their anterior hippocampus was smaller, and the total volume of the gray in the left temporal lobe were reduced. Okay, so as you can see, as compared to A, the healthy twin, and B, the twin with schizophrenia, twin with schizophrenia having a larger lateral ventricle in the brain as compared to the healthy twin. Okay, so its most important cause of schizophrenia basically based on disturbance of the prenatal brain development. That is most important cases that manifest itself after the puberty. So before I go to further subtopic on the mesolimbic dopamine pathway, I would like to revise back on the three factors that we discussed before. Okay, so the first factors is the genetic factors. As I mentioned earlier, it occurs in 1% of the population. Persons with a close genetic relationship to a patient with schizophrenia are more likely than those with a more distant relationship to develop the disorder. Okay, and second factors, the environment. One of the factors such as season of birth is highly related to the incidence of schizophrenia, where more people with northern hemisphere, for example in the western, and July through September in the southern hemisphere. One possible explanation finding suggested that viral infection of the mother during pregnancy can cause schizophrenia. Okay, so these are one example of environment factors. And next, the neuropathology or the anatomical factors such as the behavioral, physical, and also brain anomalies. For example, like studies suggest that abnormalities or anomalies in the brain, for example, like in the frontal lobes, okay, and suggest that the enlargement of the lateral and third ventricle among the schizophrenia patients are higher as compared to those without schizophrenia. So these are a brief explanation on the three factors that cause development of schizophrenia. Now I will discuss in next slide about the final mesolimbic factors, which is actually mesolimbic dopamine pathway and the neurotransmitters abnormalities that also one of the hypotheses that cause development of schizophrenia. Okay, and what are the difference between those with positive and negative symptom? So like positive schizophrenia will have different type of limbic dopamine pathway as contrast to the negative symptom with of schizophrenia. Okay, so from pharmacological evidence suggests that the positive symptom of schizophrenia are caused by abnormalities in dopamine neurons. Specifically, okay, research suggests that positive symptoms of schizophrenia are results of the overactivity of dopamine synapse in the mesolimbic pathway. Okay, as you remember, okay, please revise back in the topic of substance abuse. Okay, most researchers believe that mesolimbic pathway, which begin in the ventral tegmental area and end in the nucleus accumbens and amygdala, is more likely to be involved in the positive symptom of schizophrenia. Okay, so this activity of dopaminergic synapses in the mesolimbic system appears to be a vital link in the process of reinforcement. So drugs, okay, any drugs such as cocaine and amphetamine that act as agonists at the synapse strongly reinforce behavior if taken in large doses, and they also produce this positive symptom of schizophrenia. Okay, so whereas for dopamine antagonists, it has a opposite effect, which is eliminate some of the positive symptom of schizophrenia. Okay, so how actually the effect of dopamine agonist and antagonist, how actually the drug, the antipsychotic drug is discovered. The French, it actually started in middle of 20th century. A French drug company developed a compound called chlorpromazine, which aims to reduce shock and anxiety following surgery. So this drug was tested on patients with a variety of mental disorders such as mania, depression, anxiety, neurosis, and schizophrenia. However, the drug not very effective in treating neurosis or affective psychosis, but it has very tremendous effect on schizophrenia. Okay, so um, following of this introduction, okay, it found as a very efficacy in terms of reduce prolonged stay in hospital, eliminate the positive symptom, and also able to change the patient attitude and hallucination and delusion. Okay, and after the discovery of chlorpromazine, many other drugs have been developed that relieve the positive symptom of schizophrenia, and this drug will actually have one property in common. They block D2 and D3 dopamine receptors. It's block D2 and D3 dopamine receptors. So, uh, how we assure that the dopaminergic activity in the brains of patients with schizophrenia is abnormal? There are many studies were conducted previously to find evidence to support on this statement. Okay, so one of the study is a functional imaging based study by L'Oreal that were conducted by measuring the release of dopamine caused by an intravenous injection of amphetamine. Okay, as we know in substance abuse chapter previously, amphetamine stimulate the release of dopamine. Amphetamine stimulate the release of dopamine. Therefore, patients with greater amounts of dopamine release will show greater increase in positive symptom. As you can see in this illustration, okay, they compare between control and patient with schizophrenia. So the study found out that amphetamine caused the release of more dopamine in the stratum of patient with schizophrenia than in the control participant. Okay, they also found that patients with greater amounts of dopamine release show greater increases in positive symptom. Okay, so beside then the first study, there are another possibility that actually the brains of patient with schizophrenia itself contain greater number of dopamine receptor. Okay, so Researchers look for increases in numbers of this receptor in brains of schizophrenic patients, and there are mm, two types of analysis were conducted by researchers. The first one, the postmortem measurements in the brains of people with schizophrenia, and the second one is the PET scan of the treatment with radioactive ligands for dopamine receptors. Okay, so review of both of the studies concluded that there are might be modest increases in the numbers of D2 receptors in the brain of people with schizophrenia. However, it seems unlikely that these increases are the main cause of schizophrenia disorders. Okay, so what are the consequences of long-term drug treatment of schizophrenia? Okay, the consequences basically the result of taking antipsychotic medication. It causes many people develop a neurological disorder called as tardive dyskinesia. Okay, where actually the patient with tardive dyskinesia are unable to stop moving. This phenomenon also known as a supersensitivity, which a compensatory mechanism. Okay, a compensatory mechanism in which some type of receptors become more sensitive if they are inhibited for a period of time by a drug that blocks them. Okay, so in patients with schizophrenia condition are taking um, extended period of antipsychotic drug, okay, presumably the D2 receptors in the caudate nucleus and putamen are chronically blocked by an antipsychotic drug. Then they become supersensitive, which in some cases overcompensates for the effect of drug causing the neurological symptom to occur. For further reference on the tardive dyskinesia symptom, please watch the YouTube video based on the link given in my slide. Okay, from the video you can observe symptoms such as stiffness, tricky movement of the patient's face, and also in control body movement. Okay, body movement. Okay, so fortunately, actually, researchers already discovered, recently researchers already discovered other type of medication that actually can treat positive and negative symptom without producing any neurological side effect. Okay, so this drug is called as clozapine. Clozapine. It is the first of atypical antipsychotic medication. It's the first of atypical antipsychotic medication that appears without producing any neurological side effect. Okay. Symptom of schizophrenia was explained through another pathway of mesocortical dopamine, which was due to the hypofrontality. Okay, so hypofrontality occurred due to decreased activity of the region in dorsolateral prefrontal cortex, which may be caused by decreased release of the dopamine also, okay, on this region. So what actually produced the hypofrontality? This is where role of glutamate comes in. Okay, so specifically, the negative and cognitive symptom of schizophrenia occur due to impairment of concentration of glutamate in cerebrospinal fluid (CSF) of patient with schizophrenia. Okay, thus, very low dose of glutamate antagonists such as ketamine, which known as Special K, and PCP, also known as angel dust, okay, may produce a negative and cognitive in healthy individuals. So, from the physiological study, show that by using ketamine and PCP as indirect antagonists of glutamate and MDA receptors, okay, so it actually suppress the activity of several regions, including dopamine utilization, in which The hypoactivity of NMDA and dopamine receptors appears to play important role in the production of negative and cognitive symptoms, where the suppression of these receptors causes hyperfrontality, which appears to be the primary cause of these two. Okay, and there are interesting research that were conducted in the aspect of PCP and ketamine, okay, that might also have relevance with the causes of schizophrenia. As we learned in previous slide, ketamine and PCP have similar effect, okay. So ketamine was used as anesthetic for children and animals, but it not used often for adults. Why? Because when it being used in adults, it can cause episode of psychosis. Okay, episode of psychosis when the person awaken after the surgery. Okay. However, okay, very interesting. Ketamine does not have this psychosis effect on pre-pubertal children after the administration of PCP. Okay, after administration of PCP. Okay, so the study suggests that no answer why ketamine and PCP produce psychotic behavior only in adults, and maybe this explanation is related to the fact that symptoms of schizophrenia only emerge after the puberty. Okay, so that's all for today on the subtopic of schizophrenia. Please read further my module for the learning activities for today, okay, which you have to uh, develop your own case study, a very brief case study in one page only. In this case study, I would like to see your understanding of for today's topics, specifically on the anomalies, the mesolimbic pathway that are related to different type of schizophrenia category, and also what are the clinical symptoms. Okay, so that's all. Okay, bye. Take care and also stay safe. Bye.